Does prednisone cause cancer? That's a really important question because if you're like me and you have no choice but to take prednisone to save your life, are you going to increase your risk for cancer? Well, I have a nuanced answer for you. It is not straightforward, and I want you to listen to the end so you understand exactly what we're talking about here, because I can't just give you a yes or no answer. So the first thing to know is that prednisone is a double-edged sword. Often the side effects of prednisone are the same as the reason somebody's taking prednisone. So in this situation, prednisone is used to treat cancer. Castration-resistant prostate cancer is reliant on prednisone for treatment. It is always included in that type of cancer treatment because it helps the other drug work better, abiraterone. The combination just boosts the benefit of the other medication for some reason. And so prednisone is used for cancer treatment. It is the P on the R-CHOP treatment for cancer. It is so often used to help people with cancer that it's just kind of a given. Does prednisone help with cancer? Of course. Any oncologist would say prednisone helps treat cancer. All right? Then cancer treatment, chemotherapy, often causes nausea and vomiting. So it's called chemotherapy-induced nausea and vomiting. And prednisone is one of the most beneficial treatments for that kind of terrible nausea and vomiting, where you can't eat, you can't hold anything down, you lose weight just because you're taking chemotherapy. And prednisone can be a miracle for these people to be able to hold down their food. So not only does it help treat cancer, it helps treat the side effects of cancer treatment. And a direct quote is, prednisone is also sometimes used to treat the symptoms of certain types of cancer. So we want prednisone to exist because it helps in so many ways when it comes to cancer. But you may have this question that a specific commenter said. They said, can you direct me to more info on cancer risks with prednisone? My doctor wants me to take it for 8 weeks at 20 milligrams a day dose, and I'm terrified. So why would cancer doctors be prescribing prednisone all the time if it's increasing the risk for cancer? Well, here's one thing. When you look in the top 6 most commonly used drug information resources by doctors and pharmacists, there's not a single mention of cancer. That is fantastic. Up-to-date clinical pharmacology, lexicon, micromedics, on and on. Not a single one of them mentions cancer. So that is really, really good news, that the most reliable sources of information do not include cancer. I've got all sorts of videos about how reliable that information truly is, but they don't include it. So that's great. Recent information has been coming out because prednisone is such an ancient drug. That information I've mentioned is lacking. They didn't have to do studies to find out for sure what all the risks were. So a few researchers have done studies recently about prednisone and cancer risks. And it's just really confusing. So stay with me here for the nuances. What you need to understand is how prednisone works. Prednisone is an immunosuppressant. So people who have autoimmune conditions where their immune system is attacking themselves, or prednisone is used to help with inflammation, where there's too many reactive things happening in the body and there's arthritis or other itis conditions. Prednisone helps just turn everything down. Calm it all down, just turn off the responses so that your immune system and your inflammation system can just kind of take a chill pill. That's exactly what prednisone is. It's a chill pill for those things. And so if you need an immune system that's working properly to stop cancer from erupting, then it kind of makes sense, right? Like scientifically, if we're all kind of always making cancerous things throughout our body and our immune system is going and killing them and keeping us cancer free, then it makes sense when we turn down the immune system, maybe we're increasing the ability for those cancer-like things to erupt into a full-blown tumor or things like that. But not a lot of research shows this. Like, it's kind of more theoretical than clear-cut science. And so one study was a case report. Now, these are like the lowest quality of evidence. Case reports, and then there's randomized controlled trials that are the highest quality. So case report is a doctor's telling the story of a patient. She was really old, was prescribed prednisone for a condition for a long time, and while was on it, all of these random cancer-like things started showing up. Then they became malignant. And so was it the fact that she's really old? Was it the fact that she has a lot of inflammation leading to the reason she was taking the prednisone? Who knows? Like, cancer can be caused and exacerbated by many things. Was it the prednisone or not? I don't know. And then some Japanese researchers compared the people who were taking prednisone versus thousands of other people similar to them who never took prednisone to see what the risks were. And they were able to show an increased risk for cancer. But basically, nobody else has ever studied it. And so is it that those people have something in their lives that is increasing their risk for inflammation, immune system issues, and cancer? And that's why they were taking the prednisone? Because they were already having, maybe they're living next to a chemical power plant or something, and they're being exposed to all these terrible chemicals in their water or in their air or something. And that's leading to the condition they took prednisone for. And then they're also having cancer because of all of those chemicals. Is it causation? Is the prednisone causing the cancer? Or is it correlation? Is it the type of person who has to take prednisone is also the type of person who gets cancer because of the same root causes leading to the immune system being confused? There's just no clear answer here. And so if I have to say, does prednisone cause cancer? I'd say no, because those top 6 side effect drug information resources say no. But does it potentially have a correlation risk? Yes, maybe. The science is just not there enough to say that, to clearly say, oh yes, prednisone causes cancer. It's just not there. And so if you're worried about cancer risks from prednisone, I would not let that be your concern. It is just like a blip on the radar, really far away, potential risk. Whereas if you're concerned about side effects in general, let me share a few that you should be concerned about that are not cancer. For example, osteoporosis. The bone damage caused by prednisone is irreversible and can lead to broken bones, hip replacements, and it's horrible. The diabetes, blood sugar changes, the heart disease, the eyes, the skin. I could go on and on. There's 150 at least side effects to prednisone that I would be much more worried about than cancer, way over there as a potential possible issue to deal with. The mood changes, the insomnia, on and on. Those are what you should be concerned about, not cancer, in my opinion. And if it were a concern, the doctors who treat cancer would not be giving prednisone, right? Like, I asked AI what it thought, and it is telling me the complete opposite. It's telling me, yeah, there's this risk. And I'm like, no. Why would the doctors be giving cancer patients prednisone for years with study after study after study showing the combination improves the chemotherapy effect? That just doesn't even make sense. So don't worry about the cancer is what I'm ultimately saying. Worry about the other side effects. And if you want to know how to counteract those other side effects, I have a downloadable free PDF printable checklist of exactly what you can do to minimize your side effects while on prednisone. It's called the Prednisone Checklist. And you just click the link below to download it now so that you can do whatever possible to minimize your risks for these other side effects, not necessarily cancer, because I don't personally consider that a risk worth mentioning. Signing off as Dr. Megan, your prednisone pharmacist.